Next up, let's talk about the secondary hemostasis. Now, this might not be the one you're used to because this one is the in vivo cascade, the one that actually happens inside your body. The most common one that most of us know is the one that happens in the lab. So, yeah, this might be different from what you know. Now, the trigger for this cascade is tissue factor from vascular damage. Tissue factor activates factor 7 to factor 7A. Factor 7A activates factor 9 to factor 9A. Both factor 7A and factor 9A goes ahead to activate factor 10 to factor 10A. Factor 10 alongside with factor 10A alongside with factor 5A then turns prothrombin into thrombin. Thrombin then turns soluble fibrinogen into fibrin to stabilize or strengthen your clot. Thrombin plays a very big role in this whole hemostasis stuff. Thrombin has procoagulant effects as it is the one that converts fibrinogen into fibrin and does other works too. Then it is a platelet activator also. Alongside that, it has pro-inflammatory effects. Now, this thrombin, when it binds to thrombomodulin, instead of being procoagulant, it now changes its job. It is now anticoagulant as it activates C-reactive protein, which are there to inhibit factors that promotes coagulation. So it's not anticoagulation. Okay, so we're back to the cascade you guys know, the extrinsic and intrinsic pathway. Now, I would like to assume all of you know this, so I won't be explaining it, but just know that the extrinsic pathway determines prothrombin time, and the intrinsic pathway determines partial thromboplastin time. Now, your endothelium is the ultimate regulator of blood clots. Now, it does this by inhibiting platelets, anticoagulation by binding thrombin to thrombomodulin, which deactivates protein C, which will inhibit your clotting factors, and also by producing tissue plasminogen, which breaks down or causes fibrinolysis. Okay, so to summarize everything, let's look at the cycle of this hemostasis. The concept we're talking about here is that the clot or the coagulation must be localized at the area of the vascular damage and nowhere else. Then at that point, you start forming your cascade that leads to the clot. Then as that is happening, you're also having plasminogen being produced to help dissolve the clot by breaking it down into plasmin. Then finally, we have plasmin breaking down the clots totally, and then blood can flow properly again.